visionary behind the Preventative Health Awareness Month and movement. And today is Cancer Prevention Day. And I am super excited, actually, to have a special guest on, somebody that I know personally and have had the privilege getting to know. Her story is powerful. And I think more importantly, what we're about to talk about, which is childhood cancer, especially when we're looking through a preventative lens, is something that's often forgotten. And so I'm really excited to have with me Kirsten, who is a two-time childhood cancer survivor, as well as a young adult cancer survivor. And she is here to tell her story. And I just have to tell you, Kirsten, that I've heard your story many times. You are an inspiration. The work that you're doing and vulnerably sharing your story to help empower others, I feel absolutely blessed and honored that you're contributing your experience to us so others can learn from you and we can work together for change, so that people don't have to go through what you went through. So welcome.
Thank you, Mark.
So why don't we start with your story, and you can tell it however you feel comfortable telling it, just about, when were you diagnosed with what, and just sort of some of the challenges that you faced that is really important to share, because I'm sure there are other people that are going to watch this that perhaps are experiencing the same thing.
Yeah, absolutely. So as you said, I'm a two-time childhood cancer survivor. I was first diagnosed in 1998. So back then, the word cancer was not as quote unquote friendly as it is now. I think everybody kind of nowadays puts a twist on it to be very kind of positive. And then I relapsed. I want to say 2002, 2003, I can't remember the exact year, with the same cancer. Acute lymphoblastic leukemia is what I had. And then in 2016, I was diagnosed with squamous cell carcinoma, which is oral cancer. So for my first two diagnoses, I had chemo and chemo radiation, and then my last diagnosis was just, I say just surgery, but it was still a significant surgery to my life that impacted me and still impacts me to this day. So it's been a struggle, I guess. When I say cancer, the word cancer has changed over the last 25 years is, I think, an understatement, again, in terms of awareness. And understanding of what the disease is from both a medical perspective and a societal perspective is huge. It was definitely a challenge when I was younger in the late 90s. It was a lot of, are you contagious? Are you going to die? And people kind of wanted to stay away. Whereas my diagnosis in 2016, it was, how can we help? So very different experiences both times, and it could be attributed to the fact that I was also more aware of what was going on as a young adult. And I had, education in it and knew more about it. So.
Well, but I also think you're raising a very good point, and I certainly know we've all been touched by cancer, either ourselves or somebody we know, and the stats bear that out here in Canada. Mm-hmm. But I certainly know that there's been a change, at least from my perspective, that, you heard the C word and immediately you go to the nth degree of, death. And with all the work that's being done, and I think that's when we talk about preventative health, it's also about, providing hope and resources and empowerment. What can we be doing to advocate for ourselves? And I've seen a big change in that. And that's why we wanted to dedicate an entire day at Preventative Health Awareness Month and Movement, because it has changed, but there's still a lot of work to do. And people, of course, how human of us to get very scared when we hear that word. And it can be very scary. And like you said, you're still dealing with, and whether you want to share it or not, you're still dealing with some of the fallout of living through, or some people living with cancer.
Yeah, living with and beyond.
Yeah. Exactly. So let's talk about that a little bit, and how that's changed for you from the lens of being a young, you're still a very young person. If you're a child that's been diagnosed, or a parent of a child that's been diagnosed, I can't even imagine what that journey's been like for your parents, and how that's changed, and what you still want to do to see more change, which is why we're doing this.
Yeah, it's funny that you say about my parents. My mom was recently asked, how did you do it?
Right.
And she said, I didn't know how not to do it. I just did it. And I also like to preface, especially with childhood cancer, that there's no prevention per se of getting childhood cancer. Um, I mean, there's nothing a parent did or didn't do that gave their kid cancer. It's a sporadic, random thing that happens, and same with most other cancers too. I mean, there's links to it. But even with my oral cancer, I wasn't a smoker, I wasn't a drinker, I didn't chew betel nut, which is all three main causes of oral cancer, and I still got it. So I mean, they're causes, or they're not causes. It's associations, right? And I think just in
Risk for.
yes, put you at a greater risk for, yeah. And I just think in terms of prevention for a cancer survivor, especially a childhood cancer survivor or an adolescent and young adult, which is usually between the ages of 15 and 39, is the kind of the follow-up screenings and the long-term effects that you need to watch out for. So for me, I had certain chemos as a kid that affects my heart. So I go for yearly or every other year echoes, which is basically an ultrasound on your heart to check your heart function. So I adhere to that. In Ontario, I am very lucky to have, there's clinics across the province that are pediatric aftercare clinics. So childhood cancer survivors can be followed by oncologists for long-term effects and get their health screenings done, colonoscopies, mammograms, echoes. They can get help with school and work transitions for those who might be struggling to get a job, because cancer can also affect your cognitive abilities, especially as a child or if you had a brain tumor. So I'm very lucky, again, in Ontario, to be followed by that program and have access to those medical professionals that can help me get my screenings and watch out for those long-term effects. And for me, that can be anything from cataracts to meningiomas in the brain, which is benign tumors, to, again, heart issues or I'm trying to think of all the other side effects. But again, it's individualized based on treatment and doses. So, I mean, I don't want to get people paranoid that they've had X, Y, Z. And it's just something to talk to your oncologist and your healthcare teams about. What are my late effects going to be 5, 10, 20 years down the line? Because these things matter. Are you at risk for a second cancer? Should you follow up with people? And I think one of those things is just being a strong advocate for yourself and knowing
Yes.
your body.
Well, and that's why this conversation I felt was so important to have with you, because you're absolutely right. I mean, people don't know what they don't know. So how do we advocate and ask unless, especially when you're in the throes of a diagnosis and you're just trying to survive through that physically, mentally, emotionally, spiritually, it can be all very overwhelming and all consuming, and we often don't know what to ask. Your family doesn't know what to ask. So having these conversations and sharing this kind of education, so that God forbid if someone does experience this, oh, I remember that interview I heard. And they can be that advocate. It's really important, because I even think from a mindset perspective, and don't get me wrong, we both have tremendous respect for you keep making reference to the oncologists and the healthcare teams that we have access to. We're very grateful for that. But we have to take a role in our own health as well.
Absolutely.
And being scared to ask or not challenging the doctor, you're not being challenged. And this is the mindset we want to change. It is not being challenging to advocate and ask for things or question things or inquire about things that you're unsure of. In my opinion, there isn't a silly question, because that's how you get answers. And when you have answers, you feel more empowered so that you can do the preventative testing. And that takes away, because let's go a little bit from this point. There must be fear attached to having had cancer, and oh my gosh, is it going to come back? And you've done this.
Yeah, absolutely. So just to even digress a bit to your previous point is, I think I asked the exact same question to my doctor for 5 years at every visit until I got an answer that satisfied me and that I knew was truth. And it sounds ridiculous, but if that's what you need to do to make it make sense in your brain until you get the answer that you want, then that's what you need to do. But I would also say, and from a lot of my cancer peers, reoccurrence is 100%. For the newer diagnosed people, it's, or ones just recently off treatment, it's probably more fresh in their minds. For me, I've learned to know my body. When I get a swollen lymph node, I know there's the minor rise in anxiety, but then you drop down again saying, okay, I just had a cold. I might be coming down with something. That's probably why. I got rear-ended by a car one day, and a week later, I had a swollen lymph node the size of a walnut in my neck. They did an ultrasound. It was nothing. It's a stress response. So just knowing your body and being willing to, just as survivors, and I think that goes for any patient too, and any person, and regardless of health status, just knowing your body and knowing when something's off and going to the right provider for that care. Right? I mean, I wouldn't go to an emergency room for a swollen lymph node. I'd go to a walk-in clinic or my family doctor. But just taking that step in prevention, for me as a survivor, it's not even prevention, it's awareness of my own body.
Oh, and it's
Right?
so important. And myself as a massage therapist, the mind-body connection, and I've treated so many people over the course of my career that are going through cancer, or I found through my palpation cancers in people, and it's so important. We often live outside of our bodies because we're stressed. We don't listen. You are the most important member of your healthcare team, and you knowing your body, like you said, and then stocking your toolbox, having your team that helps you with your stress, with your movement, with your mobility. And Kirsten, that's what's been so inspiring to watch you. You really do actively roll up your sleeves, be an active participant in your health, and have an integrative healthcare team that includes your oncologist, but it also includes your fascial stretch therapist and your massage therapist and all the people, so that you feel more empowered and capable. Your health esteem is better to be able to ask those questions and advocate. I can't stress enough how important that is. And that really does help to reduce fear, even when you're walking through something that's very scary.
Yeah, 100%. You have to have that team. I mean, not just the fascial stretch, but dental and
Yes.
eye health. And I know those are things aren't covered under our health insurance plan, but oral health is it's so important to overall body health. And I will be honest, I neglected that for quite a few years because I didn't have benefits. Um, and, I felt the effects. And so just, going back to survivorship, that cancer can affect my teeth, right? Radiation can affect my teeth. So it's important that I go for regular checkups to the dentist. So it's kind of navigating, in a sense, it's like a cost benefit analysis on your own health. And it's unfortunate that we have to do that, but is the $500 or $200 cleaning and exam by your dentist worth it when the expense of cancer can be so much greater?
Absolutely.
Right? So, and again, it's so hard especially in today's economy, in doing prevention. But my biggest thing is just knowing your own body, right?
Yes.
Really knowing just what's off,
Little
what your
changes.
normal is, little
Yeah.
changes, and then knowing those little changes, if they're reflection of stress or something else that's going on in your life, or if it's something more serious, to actually go see a doctor sooner rather than later.
Absolutely. And I did love the fact that it came from you and saying you have to invest in your own health. And I get it. There's some real realities and financial constraints, especially in the world we're living in right now. And that's not to be taken lightly. Hence why we're doing this entire campaign of free education to help, as well as lobbying insurance companies and lobbying the government to help invest in programs and education and resources and therapies, so that more people have access. But you're right, that return on investment can be huge. I know recently we just did a REMS, osteosound REMS bone scan on you because, of course, cancer treatments can impact bone health. And
Absolutely.
we now have a bone scan that's non-radiation based that can be done for anyone 21 and older. So you don't have to wait literally until you break a bone to find out that maybe your cancer treatment 30 years before impacted your the integrity of your bone, you can have
Yeah.
this REMS bone scan. And yes, it costs money, but it's not crazy amount of money. And like you said, $200 investment, which the bone scan is certainly a lot less than the consequence of the financial and emotional and physical strain that going through cancer can have on you and your well-being. So
And just going on that, Mark, even catching it early. So even like if you have like for me for my oral cancer, you have a small canker, go to the dentist. If it's lasts more than 2 weeks, go to the dentist because treating it earlier is much easier than treating it
yeah,
6 months, a year down the line. I know it's a wait. Sometimes you have to wait an hour or two to see your doctor, but and getting second opinions if you're not happy with what that doctor said. You're allowed to do that, and especially when you're looking at and I don't want to worry everybody, like make everybody believe that everything's going to give them cancer. It's not. It might just be something small, but it's making that investment in your time to go see somebody and seeing them early, and again, getting those questions. And if you're not getting the answers, go to somebody else.
absolutely. And even with your bone health, when you can find out earlier in your early
Mhm.
20s, and perhaps your bone quality is compromised a bit, which is a better predictor. The latest research is saying you can have less bone because we lose bone as we age. But if you've had cancer treatments, it can impact your bone mineral density, but also your bone quality. But here's the good news, and this is why this is a hopeful story. When we know, rather than doing this and being scared, there's a lot of fear around, even if you haven't had cancer, but I can only imagine you have, of doing that screening because, oh, what if there's something wrong and then what I do? But when we examine something like your bones and we find out earlier, there's so much we can do with our lifestyle changes, our nutrition, our exercise, our stress levels. Sometimes it is medications, whatever that is, to actually slow down the progression or even improve in terms of bone quality. The earlier we know, the sooner we can make those changes, and we can prevent something like a fracture due to osteoporosis because of what you have had because of cancer. I know that I've got osteopenia. I didn't have cancer, but I had severe endometriosis, and the medication they gave me as a young girl
Yeah.
has now impacted my bones 30 years later. Nobody told me that then.
Exactly. And we don't, the thing is we don't necessarily know either with the amount of new medications coming out. We
Right.
don't know, and we don't know how it's going to affect people individually. I mean,
Right.
you could have a twin, identical twin, and they might not have, it might not, and have the exact same issues, and it might not affect them the same. So it's truly individualized lifestyleized, making up words here. But it's the whole prevention. If you catch it early, it's easier to treat or cure than if you just put it off. I mean, my tumor was my doctor said my tumor was small. It was, to me, it was big. And when they said that, I said, how could somebody live like this? And it was only like 3 centimeters, maybe 4 centimeters long. And I was like, if that's small, like what's big?
Right.
So again, it goes back to that whole, like you said, prevention, awareness, right? Get it done early, right? If you have mammograms, colonoscopies, any kind of prevention test that you have to have done as a regular citizen or as a cancer survivor or as anyone, get them done. It's just so much easier to treat early than to treat late.
Absolutely. Well, yesterday we did Your Eyes Are a Window to Your Health, and Dr. Carolyn Teskey, who is a huge advocate and a ambassador with her preventative health movement. And, she talks about looking through the eyes. You can often detect a cancer potentially far sooner than it shows up in symptoms that we would recognize. And then you can get into action. And so this is why these conversations are so, so important. So before we finish up, we always want to stock that toolbox with as many things. And just listening to you, it's providing hope and understanding for people to advocate for themselves. But I know you have some resources that you can share with us
Yeah.
for, childhood cancer survivors or anyone for that matter, or families of children living with cancer. Can you share those with us now?
Yeah, so I know a couple of Ontario, or well, one Ontario one specifically. I am located in Ontario, obviously, but I can send you some Canada-wide ones. So the Pediatric Oncology Group of Ontario is the one that runs the aftercare clinic where I'm seen, and they are the advisor to the ministry for everything childhood cancer in Ontario. So whether you're seeing, you're probably going to be, if you have a child with cancer or you are a child with cancer, you're probably seen at one of the clinics across the province. And that's how I'm seen through my aftercare. It's a great program. Highly recommend all survivors go there. And again, this is childhood cancer related. It's the Children's Oncology Group. It's kind of like a world, I think it's based in the US, but it's worldwide. Long-term, they have a list of long-term effects for those children who have undergone treatment and what to kind of look out for. Again, it's very dose dependent on your protocol, your drugs, in terms of what you got and what you need to look out for. So they have a list of long-term effects, pages long. When I say pages, I mean probably like 60 pages for people to kind of look at. And they are very technical. So again, it's something that you would want to talk with your healthcare team about to understand. And then there's always, obviously the Canadian Cancer Society. They have some great programs there.
What about Campfire Circle?
Campfire Circle, they are great. It's I would classify them more as respite in some sort of way, but also as fun. I mean, it's for kids diagnosed with childhood cancer or a serious illness. It's a great place for kids with cancer to go. Parents, don't ever be shy to send your kid there. They are so safe. I was a camper there for 9 years. This will be my 13th summer as a volunteer. It brings me such joy to volunteer there too. I would say send your kid to camp. Camp is fun. It's free for childhood cancer patients, and you can, if you are on active treatment as a child, you can send your kid there because we have doctors and nurses as well. And we are the only site, Campfire Circle is the only site in Canada that can provide chemotherapy at camp. So your kid can get chemo and then go swimming right after chemo.
This touches my heart, and I'm going to say this. It's a personal story, but my future daughter-in-law, I'm going to name her because I'm proud of her, Chelsea Dixon, is a social worker and works with Campfire Circle and does a lot with the camps. In fact, she was just here on the weekend. It was Family Day and was telling me about preparing for March break camp for Campfire Circle. And I've seen the work firsthand that she's done. We were at an Ottawa 67s game, and the kids that were there at the hockey game and the support that was given. And not only just for the kids, but like you said, the respite that gives to the parents. It's a remarkable organization. So I wanted to make sure we talked about that today.
Oh yeah, absolutely. And childhood cancer is not just a childhood disease; it's a family disease. It spans the whole family, siblings, and there is even a siblings camp as well because siblings need that support as well when their other sibling is going through a traumatic healthcare experience.
Yeah. So. Well, I can't thank you enough for your time, for your story, for your warm heart, and your ability to educate. You truly are an inspiration, and I feel really honored that you have given your time for Preventative Health Awareness Month and movement. And we're going to make sure we get a blog up so everybody can get this information. And I hope that people take your story and really take some of that into their own and be their own advocate, be the CEO of their health, because everybody deserves that.
100%. Yeah.
All right. Well, if you've liked what you've heard here in terms of the education, please share it with others. The more that you share, the more education we can give, and the more people like Kirsten that we can bring on to educate and empower you and fill that preventative health toolbox. So on behalf of myself and Kirsten and everybody, all the ambassadors behind the scenes with Preventative Health Awareness Month and Movement, thank you. Remember this, a healthy tomorrow begins with prevention today. We'll see you all soon.